it's Sasha the Diva and Dr. Tiff.
Dr. Tiff.
I like her name, Dr. Tiff. All right, what's your website address?
It is myintimatedetails.com.
Wow, can you imagine? She's a sex therapist going to talk to her. How do the guys react when they walk in to see you?
Oftentimes, guys are a little nervous.
Okay.
Usually, they're coming in with their partner or their wives, and a lot of times the wives or their female partners will initiate the contact.
Right.
But if the problem is big enough, they will come in by themselves, and they don't care.
Okay, let's talk about sex, baby. That's what you talk about, right?
I talk about it a lot.
Now, what's your phone number?
It is 404-863-8932.
What we're going to talk about is sexual pain. Are you having sexual pain? I mean, are you laying there going, oh my God, this hurts so bad, and you don't want to tell him because you know it's him that's causing the pain? So
or is it? Sometimes it's not.
Okay, hold tight, because
Stop
I'm learning
the
something
presses.
new right now, because I'm thinking it's the penis size.
Mm-mm.
So what is it? Wait a minute, what is it?
Sexual pain or dyspareunia is basically where the vagina, let's say this is the vagina here.
Yes.
Right? The vagina is a muscle.
Right.
And a lot of times that muscle will contract to the point where it's not the penis that's hurting, or the toy or whatever it is that you're inserting. Dyspareunia, usually we see a lot of pain around that vaginal area when there's been some type of trauma. When there's been, let's say even after childbirth, and there's like a perineal tear. You've had some tearing with childbirth and it hasn't healed properly, and there's some scar tissue there. There can be a lot of things that will cause pain and sensitivity in the vaginal area. Dyspareunia is about the pain. Vaginismus, which is very closely related to it, vaginismus is what makes that spasm happen.
Right.
And so if you clench those muscles really tight and can't let it go, and anything tries to go through there, it won't go through.
But wait, can I ask you something?
You can ask whatever you want.
When we clench, that feels good to him, though.
That feels good, but when it stays that way and he can't move and he can't even get in, that's not so good. It's not such a good feeling because it feels like a brick wall. And that's what a lot of guys will come in and say, every time I try to enter her, it feels like a brick wall. I can't even get in.
Guys, this is really new for me. I'm learning something. So, how do you fix it?
Well, one of the things that a lot... Here's a revolutionary way of fixing it.
Here's my aha moment.
Botox.
Botox what?
Botox that. Botox is one of those drugs where it's kind of looking for a disorder. You know, Botox they use for migraines. They use obviously for the lines.
Are you telling me you're going to give me a shot of Botox down here?
That has worked for some women.
Is that painful?
They'll give you kind of like a localized numbing agent when they use it.
Okay.
But another thing that you do, and I do this a lot, I refer a lot of my patients to a pelvic floor physical therapist. And that's someone who specializes in the muscles of the pelvic floor and really teaches you how to relax those muscles and how really you can control them. A lot of times I see sexual pain or even vaginismus with individuals who've had a childhood sexual trauma.
Right,
and it starts to present itself in their sexual relationships as adults. And sometimes the trauma, they don't even remember the trauma. It's just that every time I get ready to have sex, I clench up and I can't make those muscles relax.
Okay, so now this is a medical problem. So I want you to call Dr. Tiff at 404-863-8932. But maybe it's the size because he's so large. How do you fix that? Or is that a fix? I mean, is that a problem?
Well, it depends. Now,
I don't think
you know
so,
that
but
old saying about it's not the size of the boat, but the motion in the ocean?
Now, I don't know that saying.
Well, I think size definitely does matter. I think that length is not usually as big a problem as girth.
Okay.
When it's thick, that's when we tend to have. That's when some of us tend to have an issue. Some others of us don't have that big of a deal. But the girth is usually what's the problem. Lube is your best friend.
Okay, all right.
Relaxation is your best friend. A lot of, and especially younger women don't want to use lube. They think that, oh, well, lube, I shouldn't have to use it. No, it's your best friend. Use it. The vagina is a self-cleaning oven. It does oil itself and lube itself up, but sometimes things get a little dry, and when things are really, really big trying to go in,
we better do something about that.
you got to. You have to. There's nothing wrong with lube, and there's lots of great lubes out there that are natural, that last longer. Water-based lubes are great, but silicone-based lubes are better for stuff like this because there's more of a staying power. am I saying that right? Staying power.
Yeah.
Where it'll last a whole lot longer.
See, this is Dr.
yeah.
Tiff. Tell your website address.
It is myintimatedetails.com.
Your phone number?
404-863-8932.
Let's talk about sex, baby. Come on, Tiff.
With Dr. Tiff.
Let's talk about sex, baby. Let's talk about sex and me. Oh, wait a minute. She done changed it up.